Assalamualaikum warahmatullahi wabarakatuh. I am Fatrika Dewi. I am from Department of Physical Medicine and Rehabilitation, Faculty of Medicine, Pajajaran University Hasan Sadikin Hospital, Bandung. I will present my poster presentation, a case report, with a title, Rehabilitation for a 10 years old patient without left patella bone post-total patherectomy. First, from the overview. Total patherectomy was conducted for cases with disrupted extensor mechanism with loose component and poor bone stock. Patients should immobilize for 6 to 8 weeks post-operation. During this time, the patient were allowed to begin partial weight bearing. At 3 months post-operation, full weight bearing was allowed and full range of motion was encouraged as tolerated. And then from case description, this patient is a 10 years old patient, was consulted from orthopedic department to rehabilitation clinic for walking rehabilitation, post muscle and tendon repair with patherectomy due to total rupture vastus medial and vastus lateral of quadriceps muscles, total rupture patella bone, and open fracture patella grade 3A. The patient complained unable to stand and walk due to weakness of her left lower extremities. And then she got CAFO, or knee ankle foot orthosis, and she was trained to stand and walk using CAFO for weight bearing exercise program. We can see from the examination, this is before and after patherectomy operation. From the left side, we can see that the patient has a patella fracture, and then from the right picture, we can see that this is after patherectomy. There is no visualization of the left patella bone anymore. And then from discussion, disruption at the level of quadriceps tendon, patella tendon, and patella bone can affect extensor mechanism function of the knee. Extensor mechanism is responsible for extending the tibiofemoral joint. Patella serve as a mechanical pulley for quadriceps and contribute to increased progressive extension. Without the patella, the patient will lose stability due to reduction of quadriceps muscle strength, and the patient needs CAFO as an external stabilizer for the knee motion during the activity. After 6 months of rehabilitation with weight bearing, stretching, and strengthening exercise program, the patient can walk independently and there were improvement in quality of life of the patient. We can also see the clinical picture of the patient at the left side and her CAFO on the right side. For the conclusion, the management of the patient post-patherectomy has a good functional prognosis for mobilization using CAFO. That's all my presentation. Thank you.